Well, welcome everyone. I'm Diane Smallage. I have the privilege of being the program director of the Dental Hygiene program here at the University of New England. So I want to welcome all of you to the Dental Hygiene 2026 White Coat Ceremony as we celebrate the junior dental hygiene students as they receive their white coats. We are proud of these students for reaching this important milestone and also delighted that the senior students are here to assist with the donning of the white coats. At this time, I would like to introduce Associate Dean Bernice Mills of the Westbrook College of Health Professions. Dean Mills is a great supporter of the dental hygiene program, probably because she's a dental hygienist, and also led the dental hygiene program prior to joining the dean's office. So Dean Mills has joined us today to welcome all of you and to bring greetings on behalf of the university. Dean Mills.
Hi, everyone. Thank you for that warm introduction. I am truly honored to be here today representing the Westbrook College of Health Professions Dean's Office. Congratulations on reaching this remarkable milestone in your journey to become a registered dental hygienist. Your white coat represents far more than a professional uniform. It symbolizes trust, compassion, and a deep commitment to patient care. Today's ceremony provides a special opportunity to celebrate the hard work, the discipline, the perseverance that brought you to this moment. It's also time to recognize those that helped to get you here and supported you along the way. Your classmates, your friends, your dedicated faculty and professional staff, the UNE community, and most importantly, your families. So let's take a minute to honor them with a round of applause. To the dental hygiene class of 2027, which is not very far away, your white coat is more than fabric. It is a promise to care, to heal, and to make a meaningful difference in people's lives. You've chosen a profession that blends science, skill, and compassion, and that is truly something to be proud of. Thank you for inviting me to share in this celebration, and once again, congratulations on this incredible achievement.
Thank you, Dean Mills. At this time, I would like to introduce Brooklyn Jonke, who is not only a registered dental hygienist, but also a dental therapist, and I bet some in the audience don't even know what that is. We are grateful that she's practicing in the state of Maine. Brooklyn is originally from South Dakota, and her parents are even here today joining us in our ceremony. She graduated from the University of Minnesota in 2020 with a bachelor's degree in dental hygiene, and in 2021, she graduated with a master's degree in dental therapy. She worked as a dental therapist for about a year in Minnesota before moving to Maine to practice in a public health setting. In 2023, Brooklyn helped advocate for the full authority for dental therapists in Maine, and this was allowing them to be moved from direct to general supervision. And if you don't know what that means, it gained a lot of independence for dental therapists by enacting this. And in 2024, she was the first dental therapist in Maine to be granted full authority to practice under general supervision. Brooklyn resides in central Maine with her wife and works at a nonprofit clinic with a focus on providing care in mobile dental clinics. We are delighted to have her with us today to share her experiences and perspective on her journey as a dental hygienist and dental therapist. Welcome, Brooklyn.
All right, I apologize. I'm getting over a cold, so I may clear my throat a few times. Just wanted to say thank you guys for inviting me. Thank you, Dr. Smallage. My name is Brooklyn Jonke, and I am a dental therapist and dental hygienist who has been practicing in Maine since 2022. It's been some time since I spoke at my own white coat ceremony in 2018, but when I look back, it doesn't feel like it's been that long since I was in your shoes, anxiously awaiting the donning of my own white coat by my faculty, hoping my name was spelled right on it. It was. But that was a fear that I had. I still keep my white coat, full of etch and other stains of unknown origin from my preclinical lab, in the corner of my closet, and every once in a while I pull it out of my closet and remind myself how far I have come since I was an anxious dental therapy and hygiene student. When I graduated in 2020 with my hygiene degree, and again in 2021 with my dental therapy degree, I never imagined I would uproot my life and move 1,800 miles to a new state and become the first dental therapist with their full authority. There have been a lot of unique challenges I've faced on this journey, but it all began in a room like this with a white coat and a lot of anxiety and a dream. At this point in your journey, I'm sure a lot of your anxieties are around seeing patients in a clinical setting for the first time. What will patients think of me? What if I make a mistake? Do I really know what I'm doing? I remember getting a checklist for all our hygiene clinical requirements and thinking, how am I supposed to complete all this in 5 semesters? We did it anyway. Fears with seeing patients for the first time are understandable. You're learning something new and have never done this before aside from preclinicals in a controlled environment. Patients are oftentimes an uncontrolled environment. My biggest fear with patients was always that I would make a mistake. I had this understanding that my dental providers never made mistakes when I was being seen as a child and a young adult, and it terrified me that patients were willing to be seen with students who are understandably prone to making mistakes. Will they be understanding? And looking back, I now think about all the times my hygienist had to retake bite wings because apparently I moved. I don't know about that. I quickly learned through multiple patients that they were at the school to be seen for dental care, and they came to see us not only because they had the 3 hours available in their day for a cleaning, but they also enjoyed helping students learn how to become better providers. The most understanding and compassionate patients I ever had were during my 3 years of hygiene and therapy school. They were also some of the most knowledgeable about their dental health and wanted to learn more from the students and faculty. Oftentimes, they would ask questions about home care, cavities, or gum disease before I even had begun my assessments, showing me they were just as eager to learn as I was. One of my favorite patients from dental school was a periodontal maintenance patient who had been given to me by another student. She was the sweetest woman who took immaculate care of her teeth, making her cleanings a breeze. But I didn't look forward to her cleanings just because they were easy. I looked forward to seeing her and interacting with her. When we first met, I think she recognized that I was anxious, probably by my shaking hands when I opened my toolkit. I felt safe with this patient, and she always provided me with feedback that was kind and constructive. She never let me apologize for making a mistake. She would always remind me that I was a student and that I was there to learn. Even if I made a mistake, as long as I learned from it and applied what I learned moving forward, she did not feel the need for an apology from me. I think of her often, how she took time to get to know me, asked me questions about my wife, and at one point bought me a pack of peanut butter crackers from Costco after finding out I often skipped eating lunch to study. But I also think about what she told me. I was at school to learn. Students are going to make mistakes. Even non-students are going to make mistakes. The important thing was to learn from them. The nice thing about being in school with classmates is that you can also learn from your classmates' mistakes. A lovely D4 student will never know it, but I learned from him on day 1 of my oral surgery rotation to always place a throat pack when you extract a tooth. They are more slippery than they look. I learned from another hygiene classmate to double check that you're scaling the correct quadrant when you take your board exams. And I'm sure my classmates learned a fair share of lessons from me, from my own mistakes. Needles don't belong in your fingers. So, while the fear and anxiety with making mistakes is rational because you will make mistakes, I think a key takeaway from these mistakes is what you learn from them. The other big lesson I took from seeing patients in school was that no matter what my anxiety or my nerves told me, no matter how bad I think the appointment's gonna go, 99% of the time, it didn't go that bad, even with difficult patients. Every provider and every student has their stories. of patients who were challenging at times. But don't let these stories discourage you, and don't let your own experiences discourage you. My difficult patients have taught me to see things a bit differently. A lot of times I found that they were seeking empathy or a listening ear, perhaps feeling unheard in their previous experiences in life or in the dental office. Every dental provider will tell you that a common complaint from their patients, often as they're just being sat in the chair, is how much they don't like the dentist or how much they don't want to be there. I've heard this from my own mother. Every dental provider has a different response to this, and I find that mine often tailors on the patient. You learn to be quick on your feet in dental school, and my response to a teenager that doesn't want to be in the chair is often different than my response to a nice 60-year-old lady. One of my favorite patients in Maine, when I was up in Bangor, was a man with a complicated medical history, teetering on needing periodontal treatment, who did not take very good care of his teeth and was quick to tell me that he did not like hygienists at all, and he did not want to be there. He did not want me to tell him that it's okay or this won't hurt. There was probably a number of responses in my head at the time, but what came out of my mouth was, I understand. Cleanings often and do hurt, and this is not a fun place for people to be. He looked at me like I grew another head. I get a similar look from kids when I tell them, I don't want to be here either. And so I cleaned his teeth. If his gums looked irritated in an area, I warned him before scaling that this is going to hurt. At the beginning of the appointment, I fully expected him to request to not be seen by me anymore. However, almost as soon as I told him his feelings were valid, he began to open up. It's like watching a flower bloom in the springtime. He asked me about my journey, my life, my wife, and I learned his story as well. When he left that day, he gave me a hug and told the front desk to be sure he was only scheduled with me from that point on. As fate would have it, I pushed for my schedule to be filled with more dental therapy appointments and less hygiene appointments, and my new favorite patient, who I'd only seen once, was scheduled with a new hygienist, a recent UNE grad who has since become a very close friend of mine. When my favorite patient showed up for his appointment, he was very vocal to my colleague about only wanting to see his favorite hygienist, but that he was willing to give Nick a chance because he had learned from seeing me that you guys aren't all that bad. After that visit, my favorite patient was also now Nick's favorite patient, and our favorite patient was thrilled to not only have one, but two of us looking after his oral health. And Nick made sure to tell me that had I not laid the groundwork after my initial appointment with this patient, there would have been no way Nick could have been able to build such a good rapport with him. So I think at the end of the day, my takeaway from this story is that no matter how badly you expect an appointment to go, it's important to remember it may not go that bad. It may actually go better than you expect. And oftentimes, if you approach a patient with empathy and meet them where they are, they're often more receptive to you. A final piece of wisdom that I learned from my first boss at my first big adult dental therapist job in Minnesota was that not every provider will be a fit for every patient. You can try your hardest, but at the end of the day, not every patient is going to like every provider they see. You can't really help that. But learning that from her after 3 years of school was freeing for me, and I wish I had learned it sooner. And it made sense. Not every patient has to like me, and I don't have to enjoy every appointment I have. My job is to help improve the oral health of my patients, treat them with the utmost respect and dignity, and provide them with dental care to the highest standard possible. As long as I can perform my duty and uphold the oath I took at my own white coat ceremony and provide ethical, empathetic care to my patients, I know I'm doing my piece as a dental therapist and a dental hygienist. I'm actually not one for many words, so I'll keep my closing short, as I'm sure you are all anxiously awaiting the dawning of your own white coats. As you start to see patients, it will be daunting at first, and it will be scary, and you will make mistakes. But remember that you are learning a skill that you will carry with you for your lifetime. And as long as you are doing good by your patients, you are helping further the career of dental hygiene wherever you choose to practice. Thank you.
Thank you, Brooklyn. I want to talk very briefly about ceremonial traditions in dental hygiene, and today's ceremony is one of them. 50 plus years ago and through the early 1980s, dental hygiene students' entry into the clinic and patient care sessions were recognized with a capping ceremony. Thankfully, over time, the caps went out of style. Some of you may remember being treated by a dental hygienist who was wearing a cap. I wore one when I graduated. And many nursing and dental hygiene programs transitioned to white coat ceremonies as a means to acknowledge students' advancement in their programs and into the delivery of direct patient care. The symbolism of the white coat is significant. I think Dean Mills described it beautifully, and I think it's also been described by the National Institutes of Health in this way. The white coat ceremony has become an academic ritual in the health professions, a ceremony that signals a transformation of status from ordinary student to that of one studying to become a health professional. The white coat is a powerful symbol of transformation. White is a symbol of purity, and the white coat symbolizes the purity of purpose being affirmed in becoming a health professional. Patients need to trust that their dental hygienist knowledge and skill will be used in their best interest, always to benefit, never to exploit. Beyond the symbolic nature of meaning behind the white coat ceremony, today is also an opportunity to publicly congratulate our students for their success in the study of dental hygiene. It's not easy. For me, the white coat ceremony serves as a powerful, meaningful ritual emphasizing the transformation that occurs within an individual who is entering the profession of dental hygiene. So I have to tell you a little story, and the faculty is really tired of hearing it, but they're going to have to listen to it again. I want you to notice I'm wearing a white coat that's quite different from everyone else's. If you look at your dental hygiene clinical practice textbook, which we call the Bible of Dental Hygiene, it was written by Esther Wilkins. She started writing it almost 70 years ago. It was translated into 22 languages, and when I left her alma mater, the Forsyth School of Dental Hygiene, I gifted myself one of the white coats that she used to wear at white coat ceremonies. I know she's here in spirit, and I'm wearing the coat to prove it. Very proud. Sorry, you're going to hear it several times more before I'm finished. At this time, and before we begin donning white coats, I would like to ask all of the faculty present, both full-time and adjunct, to please stand to be recognized. These are the individuals who are the most important guides and mentors you will have as you prepare to enter the field of dental hygiene. And their guidance will become a part of who you are as clinicians, and I think they've probably already influenced many of you. So, would the faculty please stand and be acknowledged? I was hoping for applause. You got more than applause, you guys. That's great. At this time, I would like to invite Professors Lisa Potter and Joanne Moulton to come forward to read the names of our students as they are being donned with their white coats. Before I forget, at the end of the ceremony, I'm so afraid I'm going to remember to say this, please don't go anywhere. We want a big group picture, so don't take off. I'll say it again at the end, but I just wanted to plant that seed in case I forget. This year, just so you know, we reinstated the Dental Hygiene Molar Premolar Club, which is a program connecting senior students to junior students. The seniors provide juniors with a peer mentor or go-to person they can talk to, since our seniors understand what it's like to walk the walk as you enter the professional phase of your program. Juniors, we're going to ask you to please come forward one row at a time, carrying your white coat when your name is called, and we will call the name of seniors also. The first row of seniors will stand, you'll come up together, and then we'll call your names as you come forward. I know we practiced this with a few of them, just listen carefully. So you're going to come up with your molar, premolar, you're going to don the coat, and then you're going to come over here and make sure you pause to have your picture taken before you go down the stairs. Everybody got that? Good. Okay, at this time, I'd like to introduce Professors Lisa Potter and Joanne Moulton, who will read the names of our molars and premolars.
Lily Anthony.
And Senior Riley Miller.
Kendra Baker.
And Senior Gianna Ledrew.
Emma Collingwood.
And Emily Jacobs.
Megan Crosby.
And Tyra Beckford.
Amy Dang.
And Emma Chassie.
Erin Delaney.
And Sophie Key.
Alex Durant.
And Juliet Cirincione.
Maya Earl.
And Taylor Garland.
Sarah Gontijo.
And Callie Gouveia.
Kylie Green.
And Marissa Wilson.
Tatiana Hernandez.
And Kim Lakovic.
Taylor Hogart.
Maddie Campano.
Michaela Hughes.
And Mary Kate McElhaney. Olivia Rue.
Katie Klein.
And Amanda Libby.
Ari Leggett.
And Sophie Mills.
Casey Letourneau.
And Evelyn Moore.
Alexis Livingston.
And Gabby Ortiz.
Kaylee Lowe.
And Megan Oliver.
Brianna Lopez.
And Kylie Cardone.
Paige Matthews.
And Rachel Provost.
Carowyn Mergen.
And Kaya Pelletier.
Emma Mishu.
And Angelica Stewart.
Gwen Miramontes.
And Annabelle Wells.
Michaela Moran.
And Brianna Wynn.
Maddie Nielsen.
And Emily Strong.
Kim Oriente.
And the real Mary Kate McElhaney.
Emma Paquette.
And Abby Schaefer.
Giselle Piedrahita.
And Katie Semperi.
Hazel Pine.
And Ziena Barrera.
Cassidy Powers.
And Julia Rosa.
Abigail Raleigh.
And JC Lavers.
Brooke Robinson.
And Macy Chapman.
Danica Rutkowski.
And Leah Sincata.
Madison Saldi.
And Savannah Katie.
Brooke Salvel.
And Gracie Stahura.
Catherine Santana.
And Chelsea Lang.
Corbin Schreindorfer.
And Kylie Curtin.
Abigail St. Laurent.
And Eric Isabel.
Jordan Stockwell.
And Solveig Marlis.
Mary Varaca.
And Gwen Gagnon.
Morgan Vieira.
And Michelle Doobie.
Kirsten Wentworth.
And Lindsay Bullard.
Sydney Withers.
And Megan Pothier.
At this time, congratulations. At this time, I would like to ask Professor Lauren Durrell to come forward and lead us all in the Health Professions Covenant. Professor Durrell?
Thanks, guys. Thank you. The ceremony's for you, so please stand. And I want you to 180 to your parents, your friends, your loved ones. Give them a wave. Woo! Okay. I also noticed that all of your lovely programs are on the ground, so I'm going to need you guys to pick those up really quick because we're all going to do this together. Okay, but you're still going to look at your family and friends, okay? On the back. Oh, and the seniors. Guys, come on. All of you. You're all dental hygienists. Come on. All right, turn around. We are going to recite the Health Professions Covenant together. I have faith in all of us, okay? Ready? As a healthcare professional dedicated to enhancing the well-being of individuals and communities, I am committed to achieving and sustaining the highest level of professional competence, to fulfilling my responsibilities with compassion for patients suffering, and to help patients make their own informed choices about healthcare whenever possible, recognizing that effective health promotion, disease prevention, and curative long-term care are products of the combined efforts of teams of health professionals. I pledge collaboration with all of my colleagues, similarly committed to meeting the healthcare needs of individuals and their communities. Further, I will work within my profession to encourage placement of the patients and the public interest above the self-interest of my individual profession. Congratulations, you guys.
Well done, well done. So as we close our ceremony, I'd like to share a quote from President Theodore Roosevelt that I feel especially is meaningful for our students as you begin your journey into direct patient care. He said, and I quote, "Do what you can, where you are, with what you have." In the challenging times we live in, it's easy to feel powerless or wonder whether our individual efforts truly matter. But every moment you spend caring for a patient, advocating for them, or simply showing compassion contributes to something greater than any one of us. So remember, do what you can, where you are, with what you have. It will make a difference. Thank you to the families. We didn't expect so many. We were pulling out chairs. We're so delighted so many family and friends could be with us today. This concludes our ceremony. And once again, congratulations to the junior students on reaching this important milestone. So we do have some light refreshments in the room adjoining this, adjacent to the auditorium, but remember, I need all of the juniors and seniors. We're gonna have one big group photo, and then we're gonna have one photo with the juniors. So I'm gonna ask them all to come forward, don't slip away, and we'll ask the family and friends to have some patience while we get those pictures taken. Thanks so much for being with us.